most GP practices, we're a community interest company, so we don't just seek to improve people's health in terms of appointments at the surgery, we look to improve their lives and get some social gain for them as well. So we're at the forefront of a number of local projects, and I always like to be a leader in terms of trying new things. We've got quite a large team of GPs, nurse practitioners, practice nurses, healthcare assistants and reception and support staff. And we've grown from having no patients to over 5,000 patients, so the fastest growing practice in Stoke-on-Trent. In terms of our appointments, patients have got the option of either booking ahead, so if they want to be seen a week or 2 weeks in advance with a doctor or a nurse. We've got a lot of book on the day appointments for people who've got urgent needs who ring on the day. We've got a surgery in Longton, which is about 1.5 miles down the road from here. That's got about 3,600 patients, and again started from no patients and has been open for about 10 years. That's got a team of doctors and nurses that work just there, but also some of our staff that work in Meir also work at Longton. Our hope is that the Longton site will move into a building similar to the one we're in here, adjacent to an Asda supermarket, so as part of an overall Asda development. And we'd look then to be able to expand our services at Longton even further, including longer opening hours, more services, perhaps weekend opening. In addition, we have a female GP at each site because we found that a lot of our female patients want to be seen by a lady GP for various conditions. So as part of that, both of those are able to put coils in as contraception and for other reasons for patients. So we offer coil clinics, which many surgeries don't. And also both the doctors plus one of our nurse practitioners can put in contraceptive implants and remove those. So it means people can come to the surgery for those appointments rather than have to travel further or go to other places, and we can usually provide it more conveniently in the surgery.
A nurse practitioner can see patients who are concerned about something that's usually perhaps a minor ailment, that's usually what we call self-limiting, something like coughs or colds, sore throats, skin conditions, ladies' issues, period problems. Nurse practitioner has prescribing qualifications and physical assessment qualifications that enable us to assess patients and treat appropriately if need be. The benefits of the patient to see the nurse practitioner usually can get more of a speedier appointment if you're concerned about being seen by the GP on that day or the next day. There's usually more flexibility to see the nurse practitioner sooner, and it does help to free up the doctors to sort of concentrate on the more complex cases.
We're also a leader in terms of using social media, so we're one of the few practices in the city that are using a Facebook site actively. We've got our own website that's very active, and we also have our own YouTube channel. And we're looking to be one of the first practices that moves towards Skype consultations if possible. Nationally there's a big push to try and improve the way people can access GP services, and we're looking to pilot using Skype consultations in nursing homes to try and improve the services we can provide for those. We're also looking to potentially increase our opening hours even further in the future. We're open longer than any other practice already, but we're already thinking in line with where things need to go in terms of improving access as to do we need to be open longer on a Saturday, do we need to be even open on a Sunday. So we're always looking to continue to improve, take on the views of our patients and expand and improve our services.